To enable surgeons to perform standardized no-touch DMEK surgery, D.O.R.C International BV, in close collaboration with the D.O.R.C, designed and developed a DMEK surgical instrument set. Decimet membrane endothelial keratoplasty is a surgical technique for selective transplantation of a Decimet membrane and its endothelium. In contrast to DSEK, no additional stroma is transplanted. DMEK may be the first choice in the management of endothelial disorders. To perform standardized no-touch DMEK surgery, we developed the DMEK surgical disposable set. After obtaining a soft eye, 3 side ports are created with the 23-gauge stab knife. With the 30-gauge bent cannula, the anterior chamber is completely filled with air. Under air, the Decimet membrane is scored over 360 degrees and stripped using the reverse Sinskey hook. Preferably, the donor DMEK graft should be pre-dissected in an eye bank. At surgery, the DMEK graft is poured into a glass bowl. After the culture medium has been carefully drained from the bowl, using the straight glass pipette, the DMEK roll should be thoroughly rinsed with balanced salt solution. The roll should be stained with vision blue and rinsed again with balanced salt solution to remove all excess dye and form a double roll. The double roll is sucked into the custom-made curved glass pipette with the thin end connected to the 5 milliliter syringe. The recipient Decimet membrane can be removed through a self-sealing 3 millimeter tunnel incision at the 12 o'clock surgical position, created at the limbus with a slit knife. The double roll is carefully injected into the recipient anterior chamber after its orientation is checked. Once implanted, the DMEK roll should be rotated towards the horizontal meridian with gentle strokes and taps on the outer corneal surface, using the 30-gauge bent cannula. Then the graft is unfolded with indirect manipulation using air and balanced salt solution, and fully spread out over the iris with a big air bubble on top of the graft. After approximately 10 seconds, the air bubble is aspirated, after which the 30-gauge bent cannula is positioned underneath the graft to inject air between the iris and the graft to position it onto the recipient posterior stroma. The anterior chamber is left completely filled with air for 60 minutes, followed by an air-liquid exchange to pressurize the eye. Standardized no-touch DMEK is a safe and feasible surgical technique for treatment of corneal endothelial disorders without requiring major investments, while providing a fast and often complete visual recovery.